Hello, my name is Anaya Webb, and this is my week 8 return to demonstration final video over the head to chest assessment. For this video, I do not have a patient, so I'll just be using this bear here. So to start off, of course, I would provide hand hygiene and I would provide privacy as I'm entering the patient's room. I would start off with aided by introducing myself to the patient, letting the patient know that I'm their student nurse for today and that I will be completing a head to chest assessment and that it should take no longer than 15 minutes. And that basically the assessment is just to assess and make sure that there are no abnormal health issues. And I would thank the patient ahead of time for cooperating and being a participant as I'm completing this assessment. After that, I would assess my patient for their pain level and allergies. And I would identify the patient with 2 identifiers. So for my 2 patient identifiers, I would ask the patient for their name and their birth date. So my patient has stated that his name is Mr. Bear and that his birthday is March 27, 1994. So of course I would check that on my patient's wristband. The wristband states that his name is Mr. Bear, birthday 3/27/1994. I will also check that in the computer and make sure that the information on my patient's wristband and that the information in the computer matches up so that I have the correct patient. Next, I would assess for my patient's allergies. I would ask the patient, does he have any known allergies? He states that he doesn't have any known allergies that he's aware of. I would next ask the patient for his pain level, to rate his pain level on a scale of 1 to 10. The patient states that his pain level is at a 0, so I would state that the patient has no symptoms of pain. Next, I would inspect for my patient's general appearance. So as I'm looking at the patient, I would state that there are no signs of acute distress. I would next assess for my patient's level of consciousness by asking the asking my patient person, place, time, and situation. So I would ask my patient to restate his name. So he stated that his name is Mr. Bear, and I would ask my patient to state the time. He states that it is 9:49. My patient knows where he is at this moment. We're in the kitchen, and also my patient is aware of this situation and what is going on. So I would note that my patient is alert and oriented ×4 because he was able to tell me person, place, time, and situation. Next, I would assess my patient's behavior. So as I'm looking at my patient seems to have his facial expression is appropriate for the situation. His mood seems to be very calm and happy, and his speech is clear. As I'm asking my patient's questions, I'm able to understand exactly what he's saying. All right. So next, I would inspect and palpate my patient's skin and nails. So as I'm looking at my patient, I'm noticing that his skin color is appropriate to his race, that it is even toned throughout, and that I don't see any signs of lesions, incisions, or wounds. I would also I would inspect and palpate my patient's nails. So as I'm inspecting and palpating my patient's nails, I am noting that the patient's his nail bed is clean, smooth, and the nail bed is pink, and there is no signs of clubbing. I would also check for my patient's capillary refill by pressing down on my patient's nails on each hand. So as I'm checking for my patient's capillary refill, I'm noting that my patient's capillary refill is returning within 1 to 2 seconds, so that is normal. I will also palpate for my patient's skin by using the dorsal side of my hands, and I would just basically rub my hands down my patient's skin. So as I'm doing that, I'm checking for the patient's temperature, and I'm noting that my patient's skin is warm and dry. All right, so next I would inspect and palpate the head, face, and neck. So as I'm looking at my patient, I'm looking at my patient's head, and I'm noticing that my patient's head is normal cephalic, which basically means that it's normal. And as I'm inspecting and palpating, I don't see any signs of infestations or lesions as I'm looking at my patient's head. I can also check for my patient's facial features, and as I'm looking, I'm noticing that my patient's facial features are symmetric to his face. So next, I would check for my patient's eyes, and with that, I can use this pen light here. So before I use my pen light, as I'm inspecting for my patient's eyes, I'm looking at my patient's eyes, and I notice that there are no signs of redness or no signs of discharge coming out of my patient's eyes. I'm inspecting my patient's sclera and conjunctiva. So as I'm looking at my patient's eyes, I'm noting that the sclera is white and that it's moist, and that the conjunctiva is pink and moist. I can check, next I can assess for my patient's pupils, and with that I can use my pen light, and I can just kind of shine my pen light in. And as I'm looking at my patient's pupils with the pen light, I'm assessing that my patient's pupils are round, equal, and reactive to light. And I can also check for accommodation by having my patient follow the pen light with his eyes. So I'll kind of like point the pen light here, and I'll just have the patient just follow with his eyes and don't move his head, so I can move it pretty much in any direction. And I can note that my patient has a normal accommodation. Next, I would check for my patient's ears. So I will look at my patient's ears, and I don't see any signs of discharge as I'm looking at my patient's ears. I can check for hearing loss by distributing the whisper test. So I can kind of step back and I'll whisper a phrase. All right. So I stood back and I whispered a phrase of bluebell, which the patient stated. I whispered bluebell, that's what they heard. So that assesses that my patient has no hearing loss, no signs of hearing loss or anything like that. So next I can inspect my patient's nose. So as I'm looking at my patient's nose, I don't see any signs of discharge or inflammation, and there's no signs of deformities as I'm looking at the patient's nose. I can also state that I can see that my patient's nose is symmetric, and I can check for bilateral narrow patency by using my pen light, and I can kind of look up into my patient's nose. So I'm stating that I'm assessing that they have a bilateral narrow, their nares are bilaterally patent, sorry. All right, so then after that, I would, no, I can still use my pen light, I'm sorry. Next, I would check for the mouth and throat. So as I'm looking at my patient's mouth and throat, I can inspect the patient's lips, and I can see that my patient's lips, they are moist and pink. I can check for my patient's tongue and his gums. I can just have the patient kind of open his mouth, and I can just kind of, look in there. So I'm noting that my patient's tongue is moist and pink, and that his gums are moist and pink also. All right, so next I would I would inspect and also take for respiratory sounds. So as I'm looking at my patient's breathing, I don't see, as I'm looking at my patient's chest, I don't see any signs of deformity upon inspection, and there are no signs of use of accessory muscles as I'm doing inspection. So after I have noted there are no signs of use of accessory muscles and no signs of deformities, I will use my stethoscope and I will listen in the lung fields with the diaphragm. So I'll go ahead and put that on. Alright, so as I'm using the diaphragm, I will be listening on the anterior and the posterior side, and I will note exactly what I'm listening for. I will note where I'm placing the stethoscope. So this will be the right upper lobe, left upper lobe, right middle lobe, right lower lobe, and left lower lobe. Hope you can see that. Move the feet out the way. So I'll do it again so you're able to see. So right upper lobe, left upper lobe, right middle lobe, right lower lobe, and left lower lobe. So that was the anterior side, and then now I will move to the posterior side. And when I'm listening for the posterior side, I can listen for 6 to 8 spaces. So I'll go ahead and name those off. Okay, so this is the left upper lobe, right upper lobe, left upper lobe, right upper lobe, left lower lobe, and right lower lobe. So go flip the bit around. All right, so next I will palpate and auscultate for the cardiovascular system. So for that, I can start off with inspection, and I would inspect for any signs of JVD. So if my patient was to be laying down, there should be no signs. If my patient was to be laying down, there should be an expected signs of JVD. If my patient was to be sitting up at a 45-degree angle, there should be no signs of JVD on each sides of the neck. So as you see my patient sitting up and I don't see any signs of JVD, so I will note that there are no signs of JVD. I will palpate for the carotid, and when I'm palpating for the carotid post, you don't want to palpate simultaneously. So I will palpate each side one at a time. So I'll go ahead and feel for the post. Got a post. All right, I'll go ahead and feel for the other side. All right, so I do feel a post on each side. So next I will go ahead and auscultate for heart sounds, and for heart sounds I will use the diaphragm and the bell. So I will auscultate on each side for that. So I'll go ahead and start with the bell, and I will just say the placement. All right, so we have aortic, pulmonic, Erb's point, tricuspid, and mitral with the diaphragm side. Hope you can see that. So I'll do it again if you couldn't see that. So you have aortic, pulmonic, Erb's, tricuspid, and mitral. All right, now go ahead and flip to the bell side. And again, we have aortic, pulmonic, Erb's point, tricuspid, and mitral. All right. So after I have listened to the heart sounds through the bell and the diaphragm, I would palpate for the radial pulse on each side. So I'll go ahead and do that. So I'll feel the pulse on the radial side of the right arm. Feel the pulse. And then I'll feel for the pulse on the radial side of the left arm. And I got a pulse. So I will note that I have a pulse on each side. So that is the last part of the assessment. And I will end the assessment with Roth. I would reassess my patient's pain. So I would ask my patient again on a scale of 1 to 10, can you rate your pain for me? My patient states that his pain level is still at a 0. I will offer any comfort measures. If the patient needs any water, or if they need their cell phone or anything like that, I will make sure I will get that. I'll make sure that the bed is in its lowest position and that the bed is locked. And I will, of course, give the patient the call light. I would thank the patient again for being a participant and cooperating as I'm completing my assessment. And I would let the patient know that if they have any questions or any issues, that they're always available to come back. And that will be the end of the assessment. And of course, I will end my assessment with hand hygiene. Thank you.